Hello, guys. Okay, this is chapter 9. Hopefully, you won't have as many issues as we did with the previous chapters, and using the YouTube videos will be a little better. Sorry about the choppiness, if there is any. It's when I pause the slides and start again. Sometimes it cuts off my words, but I have now found a way to eliminate that. So from here on out, well, from chapter 10 on forward, we should have a better chance at smooth sailing when it comes to watching these lectures and taking notes. And if you need to rewind or stop or pause, you should be able to do so within YouTube without any issues. Please, please, please do let me know if you do have any issues with this slideshow or any of the other ones that I do post over the weekend or next week, because if you guys do not tell me, I do not know if you're having any problems. Please, again, please try to review the information within your text before you come to class. I know that you are overwhelmed with a lot of work, but it is doable. You are almost to the end, so do not let PEDS be your downfall. And again, I am here to help you as much as I possibly can. Do try to pay attention very closely to my recorded lectures, as I do try to give you examples directly from your exams. So if you're not listening to the lectures and you are only reading the book, you are going to miss some of the information. I am not just reading out of your book for my own benefit. I am trying to go over the information with you guys so that you do have a better understanding and you can connect the terms and actually apply it when you get to your exams, and not only with your exams, when you get to your NCLEX. So, with that said, we will run chapter 9. If there are any glitches, please let me know again. And this will be growth and development of the toddler. Welcome to chapter 9. Within this chapter, we will be going over the growth and development of the toddler. Let's talk about introducing toddlers. Most people, when they think of the word toddler, they think of terrible twos. But there's so much more to this age group than that. The fundamental learning process is developed as a child begins to explore the world, experience autonomy, learn how things work, including their own body, master developmental tasks such as toilet training, tolerate limitations, express desires, and develop relationships. All of these are encompassed within toddlerhood. When we talk about toddlers, this is a 24-month span, ranging from 12 months to 36 months of age, or 1 year to 3 years old. This reflects a period of rapid, unprecedented maturation and change in the life of the child and the family. The toddler evolves from a dependent infant into a more independent, more mobile, verbal, and inquisitive member of the family. This does not institute them being bad. This is just them exploring their world. Nurses and caregivers therefore need to utilize strategies to promote and assist with toddlers' mastery of major developmental skills. They must also protect the child from environmental dangers, provide structured guidelines and loving discipline, as well as promote a sense of independence and inquisitiveness. So now let's look at the physiological development. While some children initially direct their energy toward accomplishing motor activities first, others initially concentrate on verbal mastery. Generally, this does not mean one toddler is more advanced than the other. but rather it means that both will accomplish desired developmental tasks within a normal range of time. So you want to educate your parents and guardians about this. They will develop these senses at their own pace. The toddlers should show a steady increase in growth with an average weight gain of about 5 pounds per year and an increase in height averaging about 3 inches per year. The head gains a more proportion to the rest of the body, reflecting slower brain growth as the extremities lengthen. The chest circumference increases and soon exceeds the abdominal girth. Children learn to walk at various ages, with some beginning as early as 9 to 12 months. I myself started walking at 8 months. This is not to say that I was advanced, but I developed at my own pace. However, most toddlers are walking by 15 months and climbing stairs by 18 months. So, at this age, you want to teach the parents and guardians about child-proofing the house, especially those with stairs. Looking at the neurological system, improved coordination and equilibrium parallels are almost complete. The myelinization of the spinal cord as evidenced by the toddlers refined, skilled in walking, jumping, and climbing. As you may notice, back in the previous chapters when we talked about infants and newborns, they proceed their development in a self-locato way. They do not run before they walk. They do not start climbing and jumping before they're able to even stand. So know that they do go in a order, and although one sibling may do walking first, the other sibling may only crawl for a limited amount of time before they're able to walk. So you want to educate the parents on this, that neither child is delayed or advanced, but they will develop at their own pace. The musculoskeletal system, increased bone length, muscle maturation, and increased muscle strength enable the toddlers to develop autonomy. This is a very important time. They are going to want to explore and have a sense of self. Looking at the gastrointestinal and GU systems, you want to note that the stomach enlarges in size, allowing consumption of the traditional 3 meals per day. All deciduous teeth generally erupt by 30 months of age, and improve eye-hand coordination enable self-feeding. You do want to educate parents that this will still be a messy task, and not to get frustrated with the child, but do allow them to feed themselves. Food likes and dislikes also will differ from day to day. This period of decreased appetite as a result of decreased caloric need is often referred to a time as physiologic anorexia. This is normal. Parents need that reassurance that this stage is normal. These kids will be very, very picky, and some days they may eat more than others. Measures should be taken to help reduce the amount of fat in the toddler's diet by providing low-fat meals and limiting foods that are high in salt and other additives. It is also important to advise parents to offer nutritious foods during meal times as well as for snacks. Toddlerhood is an opportune time to develop healthy eating habits as well as including daily physical activities. Bladder and bowel control is typically achieved during this time, and children are able to retain urine up to 4 hours before needing to void. You want to also note that you're going to have to educate parents about toilet training, and their child needs to be ready to do so, and also not scolding them if they do have an accident at this age. They are just learning. You also want to educate them that the child may very well have an accident if they are engaged in play, which we will speak on in a few minutes. Looking at the cardiorespiratory system, you want to know that the vital signs become less variable and move closer to the adult norms. So now they're a little less hard to remember. I know with the infants and the newborns, their blood pressures vary, their heart rates vary, but with your toddlers, the vital signs are nearing the adult norms. The respiratory and cardiac rates will slow while the blood pressure will actually rise. Looking at the sensory system, the senses of hearing, smell, taste, touch, and vision develop and begin to connect as toddlers utilize all five senses to explore their world and exert autonomy and independence. Failure to develop language, unusual responses to loud sounds, or increased falls. The caregivers need to be aware of this if they have hearing or vision difficulties. Baseline hearing and vision screening should be performed during toddlerhood, and appropriate strategies begun immediately if necessary. If you do remember, we talked briefly about that within the infancy period or stage of development, that hearing and vision screening needs to begin early so that implementation can be done if there is a problem. The toddler's vision should range from 20/20 to 20/40. Okay, let's look at their psychosocial development. Attitudes related to gender identity, sex roles, and sexuality are mostly determined by the values and morals of the caregiver and the environment. Toddlers are generally able to recognize gender differences by age 2 and begin to explore and recognize body parts, most often during toilet training. They will most definitely know their full name, age, and gender by 3 years of age or 36 months. According to Freud, toddlers are in the anal stage of development. He believed improperly managed toilet training could lead to a lifelong psychological trauma with accompanying physical bowel and bladder responses. So, again, I note to educate the parents not to be so stressed over potty training the toddler. Note that because of the close proximity of the genitalia and to the urinary and anal orifices, toddlers tend to manually manipulate and inspect these areas. Masturbation is usually common during this age and should be handled in a matter-of-fact manner, thereby lessening the child's anxiety and feelings of shame. Of course, you want to instruct them not to do this in a public setting. This should be done in the privacy of their own home or their own rooms. This should not be done at school or anywhere like that. Domestic mimicry or imitation of domestic or role activities is one way toddlers express their understanding of gender roles, such as imaginative play or playing the role of mommy, daddy, or baby. The caregiver responses to boys playing with dolls or cooking in the play kitchen and girls taking a truck apart or building houses in the mud can influence later role-related thinking patterns and experiences. Gender identity is reinforced by observing same and opposite sex caregivers enact their gender roles, attitudes, and values, and by experiencing the way adults treat children of different genders differently. Looking at their psychosocial development, the major psychosocial tasks of toddlerhood are gaining self-control, developing autonomy, and increasing independence. The toddler must also grapple with new, confusing, and frightening situations. Erickson describes autonomy versus shame and doubt. The child masters the situation of autonomy and self-concept. These are strengthened, or he is unsuccessful and doubts himself or herself abilities to succeed in such situations in the future. Looking at the psychosexual outcomes of toddlers, which is in the family teaching portion in your text on page 280, you want to avoid using slang, baby talk, or confusing terms. You want to teach the child correct anatomical names, provide positive reinforcement as the toddler experiments with various gender-related behaviors. Please do not confuse the child with statements such as big boys don't cry or only boys play with trucks. You want to accept manipulation of the genitalia and masturbation as natural and normal. but it should be a private behavior of toddlerhood. You want to respond to questions with age-appropriate language, and do not make toilet training a major concentration or a confrontational issue. Try to tie in educational aspects when possible, such as washing hands and wiping from front to back for the females. Looking at the cognitive portion of development, the social smile and babbling language of infancy give way to meaningful hand and arm gestures, punctuated with rapidly increasing development of speech skills during the toddler years. Language ability develops very rapidly. It is dependent upon physical maturity as well as environmental influences. So this is why we stress the parents or guardians being with the infants during that stage of development, because as you can see, it builds on their developmental milestones as they get older. In most toddlers, their comprehension of words is usually greater than their ability to verbalize. By 36 months of age or 3 years, the child is able to converse and begin to acknowledge different points of view. The vocabulary usually expands from a few words to over 900 words in about 2 short years. Speaking in short sentences, using pronouns, and understanding directional commands. The toddler's language is more mature than their thinking process, since the meaning of all verbalizations is not always understood. Hence why they will go to school or preschool or even daycare at this age and repeat what mom or dad has said. So we want to educate the parents about that as well. So when you're talking to toddlers, you want to relate time and scheduled events to familiar occurrences such as after lunch. The child's attention span is not as long as an older child. Position yourself, or if you're the nurse, position yourself at the child's eye level before speaking to them. Use short, specific terms that the child can understand, using the child's nickname or family name or familiar name. Avoid use of literal terms such as cough your head off and things of that nature that will frighten the child, and they will not understand what exactly you mean. They may actually think their head may come off. You want to use play to gain insight and information. Please set limits firmly but gently and reward acceptable behavior. Cognitively, toddlers are able to recognize and distinguish between shapes of objects, but they are only beginning to classify objects into categories of use. In the mind of a toddler, all objects that look alike have the same function and therefore are treated equally. An example of this is if you had a can of paint and it looks the same as their bucket that they play with or their can that they play with, and they fill it with sand and dump it all out. Well, you may have paint all over your house. So you want to educate parents about this. And also you want to look at what Piaget suggests about cognitive development. You want to note that it is broken into age-based behavioral and cognitive changes, which are described in your text on page 283 in Table 9-7. Looking at moral development, lastly, toddlers have little concept of right or wrong during this age. They have a will for desire to make independent decisions and their increasing cognitive capacities. A child's ability to actually make moral decisions is based upon multiple cognitive and social interactions that exceed the abilities of a toddler. Although religious rituals and symbols may not be understood at this time, the child does enjoy interacting with adults and children around simple religious stories. These are all things that you will want to educate the parents or guardians about, because trust me, they do not know each of these developmental milestones, and they can be very confusing for the parents. And this is how sometimes things are overlooked, and the child may very well be developmentally delayed, but the parent is not aware because they are not educated well enough on the developmental milestones of the toddler. Let me now give you a few developmental milestones that you may see within this age, because I know it can be very confusing, and As I stated before, you will revert back to chapter 6, which goes over these theories and the theorists themselves and how they think that these children develop. So let's say a 15-month-old, some of their milestones may be using 4 to 6 words. They may scribble on paper or a board with a pencil or a crayon. By 18 months, they're able to stack blocks. Overall, they should be able to creep up the stairs. That's why we always educate about safety in the home. They're able to run and jump in place. They are able to name at least one body part. And if they are not, at least by age 2, you may want to consider some type of developmental delay. They will also engage in parallel play. They should be able to name at least one color. They should have vocabulary of at least 40 to 50 words by age 2. And usually, like I said before, they'll know their full name, age, and gender by 3 years or 36 months of age. At the 20-month mark, you may notice that they have imaginary playmates. They do have very little concept of time, but they will also demonstrate egocentricity. Although this age group will want to express and explore, and they strive for autonomy, you may note, and you want to educate your parents, that they may revert to some type of dependency some days, and that this is normal. Here we will look at toddler and their health promotion. As the pediatric nurse, your role will be to advocate for the child's rights, such as access to adequate nutrition, health care, and safe living environments. The pediatric nurse's best practice for promoting health must include an awareness of the implications of culture, ethnicity, social structures, illiteracy, socioeconomic factors such as poverty and homelessness, mass media, genetics, genomics, and health disparity. Parenting is a journey one is not often prepared to begin. Parents or caregivers of toddlers need preparation and patience to deal with this emotional period that their child will experience during these volatile 24 months of excitement and frustration. Nurses need to provide assistance and guidance to caretakers for common issues such as nutrition, sleep, dental hygiene, safety and injury prevention, health screening, negativism, ritualism, regression, discipline, sibling rivalry, temper tantrums, toilet training, childcare, and play. Nurses can be most effective in working to promote health and maintain wellness by participating with multicultural perspective and considering a cultural orientation when providing support and education for the toddler and family regarding common health promotion issues. Looking at the routine health screenings, caregivers should be encouraged to schedule well child visits at 15, 18, 24, 30, and 36 months of age. Additional visits should be made if illnesses occur. What you do want to be aware of is that different cultures believe that they should care for the child if they are ill unless the child has a serious illness in which they cannot take care of, basically. So don't scold the parents. As nurses, you have to be aware of their culture and what they do when their child is ill. And some cultures even believe in rituals and things such as coining, and it may look like abuse. You want to make sure you are culturally aware and competent, and also culturally sensitive when you are caring for children. because these things can happen. You want to make sure you're educating them also on the immunization schedule. Your text has a very detailed immunization schedule within your text. There's also an appendix in the back of your text with the immunizations. I will not make you memorize these immunizations because they get very confusing, and I do not want you fixated on what dates or what ages they get which immunizations, because this can get very complex. But I do want you to actually take a look at the table within your text. If we come across the page, I will let you know what the page number is. But I do just want you to kind of glance at it and get a feeling of the immunization schedule that they have. Caregivers should be encouraged to complete the initial immunization series in a timely manner to protect their child and to prevent delayed school entry. And as I stated before, some of these schools, depending on the state regulations and laws, they will not allow the child to enter school if they do not have up-to-date immunization records, even if they sign a declination. So you have to be aware, and please do let parents and caregivers know that they too must be aware, if that is one of their religious preferences or moral beliefs, that the child does not get immunizations, that it may affect the child as far as going to school. Health screening should always include a complete physical examination, including the blood pressure, height, and weight, evaluation of hemoglobin for iron deficiency anemia, a dental evaluation, and vision and hearing assessment. The head circumference should be measured at all visits up until 36 months of age. In addition, serum lead levels should be obtained in children exhibiting poor growth patterns or neurological irritability, or in those living in high-risk areas. And remember, I said those that live in older homes that have lead-based paint, they need to be educated about that as well, because what do toddlers do? They like to eat the paint. That's one of the things they like to do. So we do want to educate the parents on that as well. And you may be wondering why they take the head circumference up until 3 years of age. That is because of the risk for hydrocephalus. It is not always apparent at birth. So we do measure the head circumference up until they are 3. As far as nutrition goes, today nutrition is an important aspect of promoting health, of course. There also continues to be significant in the difference in obesity according to race and ethnicity. So we truly want to talk about the foods that these toddlers should be ingesting even when they go to school or daycare. As nurses, you want to provide nutritional counseling. It is important to teach that introduction of good eating habits and good foods, such as fresh fruits and vegetables, low-fat protein sources, and complex carbohydrates during the toddler years, fosters growth and development, and it is instrumental in helping reduce future health risks such as anemia, non-organic failure to thrive, dental decay, as well as obesity-related health risks. It is also important to remember that food habits and attitudes developed during childhood have long-lasting effects. Parents can make mealtimes enjoyable rather than stressful by setting mealtimes where everyone eats together. Mealtimes continue to be messy during this age, but in an effort to promote autonomy, you do want to allow the child to feed themselves. Also, you want to start out with small amounts of food on a plate. The child may want to eat the same thing for days and days at a time, and they may not want to eat at all some days. This is the physiologic anorexia, and this is normal for the toddler. You want to also try using colorful foods on the plate when you are going through the nutrition with the toddler, you do want to educate the parents in this as well. Caregivers should be encouraged to provide praise and positive reinforcement since scolding causes tension and stress. Eating habits are established in the first 2 to 3 years, and forcing food or creating periods of extended tension at mealtime is not healthy. You want to educate them on limiting the access of eating fast foods, and juices should be limited to 4 ounces per day because it is a nutrient-dense food that often replaces calories that should come from more nutritious foods. Caretakers who understand these ideas will have better a better sense of introducing new foods reflecting the child's abilities. When we look at sleep, most 2-year-olds require about 10 to 12 hours of sleep each day, with a nap generally late in the morning and afternoon. Self-elimination of the second nap is a normal part of development for the 2-year-old. Sleep is important to re-energize the toddler and promote growth and development. Lack of sleep makes toddler feel tired, cranky, and irritable. Caretakers can develop a naptime and bedtime routines. This is good. Bedtime protests can be reduced by beginning a winding down period when toddlers are bathed, cuddled, and or read to prior to being put to bed for the night. You also want to educate the caregivers that it is important to let the child cry for a short time, since this assists the child to learn self-calming and comforting measures. Nightmares are also common during toddlerhood since their dreams seem very, very real. The toddler will generally respond to gentle reassurances and most often return to sleep and not remember the dream the next day. You also want to educate these caregivers and guardians not to bring up the fact that they had a bad dream the night before, as it may reoccur. Lastly, when looking at the dental health, young children are unable to brush all areas of their mouth, and as a result, the caretakers need to assume some responsibility for effective teeth cleaning. You have to tell the parents that you cannot make the toddler go brush their teeth and not watch them do it, or not make sure that they have brushed their teeth adequately, because a 2-year-old does not quite understand cavities and dental decay and food getting stuck and things of that nature. So the parents do have to assume some responsibility. Toddlers may use only water because they dislike the taste of and the foam of toothpaste. But now they are making so many toothpaste for children that it's nearly impossible not to find a toothpaste that the child likes that they can use. One last thing I want to make sure I point out: when these toddlers are growing and exploring and developing, you really, really want to stress to the parents or the caregivers to allow this sense of autonomy. If this means feeding themselves, you want to let them know it's okay and that it will be messy. If this includes allowing them to pick out their own clothes, you want to educate the caregivers that they may not match most of the time, but that's what they want to wear. So allow them to do that. As long as they have on some clothes, they should not make a big deal out of it. Same goes for potty training. Do not make such a big deal out of it. And I think most parents and caregivers stress the norms to the extreme, and they do not realize that they are affecting the child's ultimate autonomy in the process. Now we will look at safety promotion and injury prevention, which is a large part of toddlerhood, and this is very important for us as pediatric nurses and care providers to provide education to the caregivers. Most injuries and deaths to toddlers are due to airway obstruction, poisoning, drowning, falls, burns, and automobile Drowning is the second most common cause of death due to unintentional injury for children ages 1 to 4. An increasing concern for nurses and families is the presence of firearms in the home. You want to make sure you're educating these parents that if they do have to have a firearm in the home, that it needs to be securely locked away in a place where the child cannot even get to it. Because these toddlers are exploring their world and environment, they will get into everything. And this is how they are accidentally shot. They are accidentally falling down the stairs and things of that nature. So it is very important to teach caregivers about these things that most oftentimes they just overlook. Non-fatal injuries lead to approximately 10 million visits to the emergency department every single year. Every year, 1 out of 5 children seeks medical help for an injury. This can be prevented. So education is key here. Motor vehicle accidents are the leading cause of death during infancy and childhood. This is not talking about leaving the child in the car. I know this has been on the news quite often lately, how people are leaving their infants and toddlers strapped into the car seat in the car in the middle of the summer. That's just crazy. Toddlers should always be strapped into a child safety seat appropriate for weight and size. The safety seat should be placed in the back seat of the vehicle in the middle seat if possible. This is because of the airbags on the sides in the rear of the cars. If there is no middle seat, then of course you have to use either or. But they should not be going in the front seat, of course. Toddlers should not ride in the front no matter what. A booster seat, one with outside arms, is not appropriate until a child weighs at least 30 pounds. Transition of a child from a booster seat to lap shoulder belt should not occur until the child reaches at least 4 years of age, 85 pounds, or 4 feet tall. Toddlers should ride rear facing as long as possible, generally until they reach the highest weight or height allowed by the car seat's manufacturer. And oftentimes I see so many parents turning their toddlers around because the excuse they come up with is so that they can see them or so that they can participate with them while driving. You are driving. Why are you trying to participate in anything with your infant or your toddler? It's just quite crazy that no matter how much you educate, people still seem to be idiots, basically, about infant safety and toddler safety. This is some of the easiest thing to do, yet they ignore them. Drives me insane. You want to note that by 3 years of age, the child should begin to understand the concept of stopping and looking both ways before moving into the street. This is not to say that they should be crossing the street by themselves. I swear we have to tell people the obvious nowadays because they just do not get it. As far as home and environmental safety, homes and surrounding play areas need to be child-proof to prevent drowning, falls, and accidental poisonings. Make sure if you do have a pool or if the parents or guardians have a pool, that they know about pool safety and that the screen doors should be locked or even the doggy doors. I don't know if you guys have heard in the news lately about the child who climbed out through the door and was found in the pool. That is just craziness. So we want to make sure that we're educating our parents about this type of safety because kids are dying. You want to look at the nursing alert in your text on page 290 about the common car seat mistakes. Usually the harness is not used with the car seat or the harness is too loose. The infant seat is facing forward We see that all the time. Or putting the baby in the car seat that is meant for a larger child. We also see that. And before the child leaves the hospital, and this is going back to infancy, we do make sure that the parents have a car seat and the child actually fits in it correctly. As the child starts to grow and we're now in toddlerhood, make sure you have the right size for the toddler. They are no longer going to fit in the infant car seat. That is crazy. And we understand that car seats are expensive, and the hospitals no longer donate them or give them out for free, but there are referral services out there that can assist. So you do want to educate your parents on that. The child should never be left alone, and this is talking about water safety, even in the bathtub or the pool. Since the child attempts sand, they may result in a fall and they may drown. And you want to know that these toddlers aren't that big. They can drown in 1 foot of water, and you may think that is crazy, but we have had it happen. Toddlers should not be allowed to go near any standing water without adult supervision. I say they should be going near water, period, at this age, if they are, because now we have the innovative parents that want their infants to learn to swim. They want their toddlers to learn to swim, and aqua aerobics and things like that. So I think with the right education that these kids will be okay. But they should have life jackets. Those are always recommended, whether they're poolside or at some freestanding water. And of course, they should be required if the toddler is on a boat. Toys and injuries and safety. Toys must be strong, safe, and large enough to prevent swallowing. Why parents still give their children marbles and little jacks and things of that nature, I'm not sure, because what are they still doing? They're still exploring, and they still, for some reason, like to put things in their mouth. So, to avoid that, do not give them things that they can swallow, okay? Also, like I said earlier, if guns are in this house, make sure they are kept locked away from the inquisitive toddler. And if you can see in your text on page 291, the safety locks on the cabinets, keeping the top away from the stove. It looks as though one of them is trying to climb into the oven. That is just not okay. But these are things that you have to educate your parents about, because things that they think are so simple will be the same things that can kill the toddler. Now let's look at the last portion of growth and development for the toddler. We will first take a look at negativism. This is an expression of the toddler's constant search for autonomy. Characteristically, the toddler seems to delight in the opposite of what is asked, or responding no to all requests, even if the child does not really mean no. The caregivers are frequently frustrated when trying to deal with the toddler's negativism, and delighted to learn that this period typically passes at about 30 months of age. You want to educate these caregivers that they can select their own methods of dealing with the child's negativism, but you do want to teach them some ways of handling when the child says no. First of all, you want to reduce the opportunity to say no. Do not give the child an option if one does not really exist, such as asking them if they want lunch. Ask them instead, do you want a peanut butter or cheese sandwich, or crackers or apples? Things of that nature where they have to make a choice. Avoid complex requests or overstimulating situations, such as trips to the grocery store or long car rides, especially if the child is hungry or tired. Do not draw attention to negative behaviors, but if you are going to deal with them, do it immediately. Otherwise, the child will have forgotten why you're even reprimanding them. Also, you want to teach them not to threaten the child, especially as a reaction of frustration or anger. When dealing with negativism, you also have to deal with ritualism. This is the need to maintain sameness, such as the same cup or spoon. The toddler needs stability when the expanding environment when they're within their expanding environment, and to know when in a new play area familiar people and places will still be available. Rituals such as mealtime and bedtime routines provide repetition where the child may gain comfort and security. The best initial approach is to ignore regression while complimenting the child on positive attributes and behaviors. When caregivers assess the toddler's behavior, they often assume regression is an act of defiance or willful disobedience, when this is really not the case. Your child, when we're looking at regression, it means that they'll return to an earlier, safer, more familiar behavior. But this isn't always because the child is being disobedient. It is not uncommon for toddlers to demonstrate a variety of behaviors, especially when they are stressed. When you look at disciplining a toddler, how should this be done? Let's first look at limit setting. This is letting the child know what he or she is able to do and not do in a situation. It is an important part of toddler discipline, since we all tend to function better when both the expectations and limits defining actions are known. Caregivers who provide the toddler with clear and concise limits facilitate autonomy development and help the child gain a sense of order, control, and security. You want to teach the caregivers that they need to predetermine and communicate limits to the child. They need to allow limit testing, assist in achieving mastery and socially acceptable behaviors, provide ways for channeling undesirable feelings into constructive activities, avoid disciplining in the wrong place with the wrong motive or wrong timing, avoid threats to discipline, always follow through. You also want to teach the caregivers to follow discipline with love and positive encouragement. When looking at temper tantrums, these are an outward explosive reaction to inward stressful or frustrating situations that are a normal part of toddler life. Between 2 and 3 years of age, the child is faced with new environments, new rules, and also new fears. Toddlers need to express their feelings, wishes, and frustrations, but lack the language skills to do so. All of these new experiences, coupled with the child's quest for autonomy, may create tension and erupt into a tantrum. Tantrums are ways toddlers say, "I have needs, I am important, I have to have some control." A typical temper tantrum may involve crying, screaming, falling onto the floor, kicking of the feet, flailing of the arms, banging the head, and breath holding. Head banging requires intervention if it is continuous or unsafe for the child. To prevent injury, the caregiver should hold the child's head, few comments to prevent the negative behavior, or provide a protective mat or a pillow. Beyond this, as with any attention-seeking behavior, the tantrum should be ignored. Speaking softly and calmly, recognizing the child's feelings, and holding can help. When breath holding occurs and the child appears to faint or stop breathing, caregivers frequently become frightened and rush into frenzied action, which only reinforces the tantrum's behavior. Therefore, caregivers must be taught that breath holding is usually harmless. The child may faint, but will automatically begin breathing as soon as the carbon dioxide builds up and stimulates the respiratory center. Although caregivers are not encouraged to intervene during the tantrum, they should remain close by to prevent traumatic injuries. It is also helpful to remove the child from public attention. You want to note that disciplining a child after a tantrum usually is of little value. Tantrums cannot always be controlled, but caretakers can take measures to lessen their frequency or intensity, including developing a regular schedule for the toddler reducing the need to say no, allowing choices, rewarding good behavior, and, of course, staying calm. Tantrums can sometimes be avoided by the use of timeouts or by placing the child in the bedroom before the behavior escalates. Temper tantrums are considered a normal developmental response of toddlerhood, but should disappear by 4 years of age. And you want to also educate the caregivers that if they are going to use timeout, it should be no more than 2 to 3 minutes. The toddler will often forget why they are even in timeout if it is longer than that. You want to remember also that it is better to praise for correct behavior than to punish for wrong behaviors. When we look at sibling rivalry, this is defined as an intense feeling of jealousy between siblings, and it is often seen when an infant is born into the family with a toddler. The arrival of this new baby can be devastating for the toddler since they now must compete for the caregiver's attention and fear loss of love or abandonment. Now we're back to toilet training again. You want to know that success depends on the readiness of both the child and the caregiver. Myelinization of the spinal cord and development of the sphincter muscle control occur at approximately 12 to 18 months and must be completed prior to beginning bowel and bladder training, since the average toddler is ready to begin toilet training approximately 18 to 24 months. Bladder control is often more difficult to attain than bowel control. Punishment and coercion can lead to shame of feelings and inferiority. Telling the child how the body makes pee or poop daily and helping the toddler succeed can encourage participation and responsibility. Recording the child's progress and not punishing for accidents is also important. Consistent day and night dryness should be achieved by 5 years of age. The play of a toddler is or has been known as the work of childhood. Object exploration also enhances fine and gross motor development and coordination. Toddlers most often play alongside rather than with children, which is known as parallel play. The toddler demonstrates little attention to the feelings of play partners and frequently grabs desired toys or hits others to keep a favorite toy. Play fulfills 3 functions for toddlers, including facilitating cognitive development by permitting exploration of the environment, learning about objects, and solving problems. It also advances social development, particularly through fantasy play when acting out roles. Finally, it permits problem solving, prevents frustrations, uses excess energy, and assists in coping with inner conflicts and anxieties in non-threatening ways. A portion of the play experience involves make-believe, pretending, or fantasies. Fantasy and make-believe help conceptualize what and how a child wishes the world to be. As for physical activity, parents do play a key role in helping the toddler develop a positive attitude and health habits, including exercise. It is recommended that children and adults spend about 60 minutes a day in physical activity. As for the nursing management, nurses, you can be advocates for toddlers and families and identify those children at risk due to environmental, economical, sociological, and physiological factors. Nurses should also be involved as a leader and help establish laws and policies that will promote children's health and well-being. Finding for safety education, developing programs for assessing low or no-cost health promotion services, education regarding nutrition, and of course, physical activities. Okay, guys, this concludes Chapter 9. As you can see, or if you have noticed, that we do tie in some of the theorists when we go through growth and development of each stage. So I hope that you see by now we're kind of breaking it down for each stage, all the way from the newborn, and we'll go all the way through adolescence. But this should start coming back to you or become familiar because we've gone over all of this information, or you've seen or heard all of this information within chapter 6, and you've seen some of these questions within your test that I have gone over again, because now we're going over each age group individually. So I hope that this helps. Please do let me know if you have any questions, comments, or concerns. And that will conclude chapter 9, which was the growth and development of the toddler.